I meet a lot of veterinarians and a lot of pet owners, and there's challenges of getting consultations and getting information. And so I've often been asked if I would do consultation. So it's something that I've been toying with over the last couple of years. Hey everyone, welcome back to the vlog. Today's vlog, we're going to talk about seeing a specialist because it's something I feel really passionate about, that if your pet's diagnosed with cancer, that you should see a specialist. But I'm also really practical, and I know that it's not always easy to see a specialist, and you may be in a part of the country where it may be 4 to 6 hours to see a cancer specialist like myself. So I want to talk about why I think it's important that you try to see a specialist, but then maybe some options if you can't. And I'm offering a new service if you're in an area where you can't get to see a specialist. So hopefully that'll make it a little bit easier. And then another little bonus, I want to talk about another type of second opinion. So there's a second opinion where you go and you see a specialist, or your veterinarian consults with a specialist like myself, but then also biopsy second opinions, because I think they can be really important in this whole process of second opinions. So let's break it down. Let's do it. So if your pet has recently been diagnosed with cancer, your veterinarian has probably suggested that you go see a cancer specialist. And I think that's really important. And I'm going to put links below on how to do that. And usually the easiest place is a website called vetspecialist.com, and you put in your zip code and that you need to see an oncologist, a cancer specialist, and they'll list the closest cancer specialist in your area. The problem can be in certain geographical areas, you may be lucky enough, like in the metro New York area where I am, there could be 20 oncologists, same thing in LA, but in certain parts of the country, there may be 1 or 2 oncologists. So it can be hard and challenging sometimes to find an oncologist in your area. One of the other issues is sometimes there is a backlog. It can be weeks, if not longer, to get your pet in to see, and that can be really stressful when you're stressed that your pet was just diagnosed with cancer, or maybe that there's a high suspicion that your pet has cancer. But in general, in my opinion, it's really important to bring your pet in to see the cancer specialist like myself. I like to do the physical exam, see the pet, and in addition to that, review the complete medical records. Getting messages, about your pet, my pet has this, is not the same. I need to go through the medical records, see the blood work, see the biopsy and the cytology reports, maybe review x-rays, maybe I need current imaging or other things like that, but a really complete overview of the case. So in my opinion, the best thing that you can do is make the trip, at least that first trip. And what I always remind everybody is it's not a commitment to doing treatment, doing surgery or radiation or chemotherapy. It's just an information gathering appointment. I also have another video about recording that, doing an audio recording on your iPhone, or, so you can remember the information, because I know how overwhelming it is. But I think it's really important, if you can, to try to see the specialist in person to collect all that information and help make a decision. And a lot of times people who think they don't want to treat, once they have the information, they will consider treatment, or maybe palliative options, comfort supporting, supportive treatments. There's often a range of treatment options that you don't know about. So again, it's great to watch these YouTube videos and learn about the options, but again, often getting individualized recommendations for your pet and their cancer is going to be the best thing that you can do. Okay, but what if you can't get to the specialist? What if they're hours away? What if they're booked? What if it's just logistically not possible for you to get in to see a cancer specialist or another specialist? In the US and Canada, it's estimated right now, I think the last time I looked, there's 450 oncologists. And as I mentioned, we're often clustered in major metro areas. Dermatologists, very similar. There's 350 in the US. And so it can be really challenging to see certain specialists when your pet has an issue. And that's always frustrated me. And so I lecture around the country and internationally, and I pause because we're dealing with COVID-19 right now, and a lot of those conferences have been canceled. But I meet a lot of veterinarians and a lot of pet owners, and there's challenges of getting consultations and getting information. And so I've often been asked if I would do consultation. So it's something that I've been toying with over the last couple of years. And so something that I've just recently launched with a couple of my colleagues is something called Fidu. And this is teleconsulting. And this is consultations for specialists to general practitioners. And if you're a pet owner, you may be saying, well, how does this help me if I'm a pet owner and I want to see a cancer specialist like you, Dr. Sue? Well, something that you can do is talk to your general practitioner and say, to get the information and say, hey, can we, start with a consultation with a specialist? And then your veterinarian can get online and arrange a consultation with an oncologist like myself. And what's really cool about that, it's not the same as me seeing the pet, but all the medical records are uploaded, so I get to see the biopsy reports and the blood work, and then I get to do either a video chat or a phone chat, and then we write a written recommendation for your pet, and that gets, sent to your veterinarian, and then past that information can get sent on to you. And so the reason I'm doing this is to be able to help veterinarians in parts of the country where, maybe they can't get in to see a specialist right away, or you can't get to see a specialist, or, often there are veterinarians who manage cases, but they need a little bit more, support. And I'll be honest, I still consult with my oncology colleagues, my resident mates, and we still brainstorm about cases, and I still consult with other internists and other specialists along the way because, I think it's great to get the input of other specialists. So this is just another service to be able to provide consultations from specialists to general practitioners. And, so again, if you're watching this and you'd say, well, I think that would be something I would want to try, you could talk to your veterinarian about arranging a teleconsulting consultation with one of our specialists, including myself, and that's fiduvet.com, and we'll put a link below. Sometimes I'll do consultation through FiduVet, and I'll say, you know what, this is a case I really think needs to see an oncologist in person, and then there are some cases I work with a general practitioner for them to manage directly with the pet owner like yourself. The other thing that I wanted to include in this conversation is the idea of biopsy second opinions, or, so when your pet gets a biopsy and we get back what we call a histopathology report, the biopsy report, those terms are often used interchangeably. And, for many cases, when I see the pet and I look over the biopsy, I will get a biopsy second opinion. And when I talk to the clients, I will always let them know that the biopsy, a lot of that description, that diagnosis is an art and a science. It's not like when you submit a CBC or blood work and you get back a value. It's a written description. There's a lot of interpretation in there. And a lot of the times I will want a second set of well-trained eyes to tell me the tumor type, the grade, and other characteristics, because so much of what I'm recommending for that pet is going to be based on that biopsy. And there are times where I will get a biopsy second opinion and it will change the recommendations. It may change the grade and things like that. So especially if it's an uncommon cancer, recently I had most dogs, when they have splenic tumors, hemangiosarcoma is the most common malignant cancer. Recently, I had a dog that had a low-grade splenic cancer. And so that was one where I definitely wanted a biopsy second opinion. And I was be sure to request one of my favorite pathologists who I know has, a strong interest and is very well trained in oncologic biopsies and surgical biopsies. So I always will have, two of my favorite pathologists review my cases when I'm looking for biopsy second opinions, and that's going to be super important. So that's often going to be something that your oncologist, your cancer specialist is going to do when they get when they see your case, is that biopsy second opinion. So second opinions are important. And, I just recently had another case, a dog drive down, well, the dog didn't drive down, but the owner drove down. It was a mast cell tumor case. She has an oncologist in Maine, but she wanted my second opinion on the case. She's not planning on staying with me. It would be too complicated for her to come down hours to drive down for her dog's treatment, but she just wanted, it's a complicated case, and she just wanted my input on the case. And I think that that's really important. It's okay to have multiple specialist opinion. I think once you start to get like 6 people opinion, it could get a little bit crazy, but I think it's reasonable to get multiple opinions when you're dealing with cancer. Just realize Not everybody treats things the same, and that's okay. The more opinions you ask for, you may get varying opinions, and it could get a little bit complicated. But, you know, it's okay to ask for a second opinion. And if they're different, you know, you just have to deal with that. But I think it's important, you know, again, with these biopsy opinions, if they're different, we're going to have to sort through that. If you meet two oncologists and they have varying recommendations, you know, you're going to have to decide how you feel with that. With the one that came down from Maine, you know, I said, she is going back to the other oncologist, and while it's great that she came down and got my opinion, you know, the other oncologist is going to be the one who's primarily taking care of it. And I do tell people, like, I can't manage cases over the phone. I can't manage them over the internet. It is going to be the veterinarian who's taking care of that case, who's the primary doctor. What I do like about Fidu, one of the things that we offer is we can do repeat consultations and follow-ups and things like that. And that allows me to review more medical records and really stay in touch with the cases. And really, again, review the cases, talk to the veterinarians, do those video chats. Again, not the same as me laying my hands on it and managing the cases directly. But again, with the shortage of veterinarian or specialists in certain areas, I think this will provide a great service. So I'm really super excited about it. Again, we'll provide links below. If you're a veterinarian, please check us out. If you're a pet owner and you're interested in having your veterinarian get a consultation, there are links below as well. Right now we have oncology and internal medicine consultations, and soon we'll be offering dermatology and other specialties to follow as well. All right, guys, that is it for today. Thanks so much for watching. As always, I look forward to seeing you at the next vlog, and let me know what other questions you have, and we'll see you soon.